Acetaminophen. Mechanism of action. Acts on hypothalamus to produce antipyresis. May work peripherally to block pain impulse generation. May also inhibit prostaglandin synthesis in CNS. Pharmacokinetics. Peak plasma time 10 to 60 minute PO immediate release. 60 to 120 minute PO extended release. 6 HRPO 500 milligrams. Conventional tablet. 8 HRPO 650 milligrams. Extended release tablet. Metabolism, liver microsomal enzyme systems, conjugation. Glucuronic sulfuric acid. Metabolites and acetylp-benzoquinone and acetylimidoquinone. An APQI further metabolized via conjugation with glutathione. Half-life elimination 1.5 to 3 are adolescents, 2 to 5 are children. 4 hours infants, 7 are neonates, 2 to 3 are adults. Excretion, urine principally as acetaminophen glucuronide. With acetaminophen sulfate, mercaptate. Dosage and indications. Analgesia and fever. Immediate release. Regular strength 325 to 650 milligrams po. PRQ for PRN. Not to exceed 3,250 milligrams day under supervision of healthcare professional. Daily doses of up to 4 grams per day may be used. Extra strength 1,000 milligrams POQ 6 to 8 hours PRN. Not to exceed 3,000 milligrams day. Under supervision of healthcare professional, daily doses of up to 4 grams per day may be used. Extended release. To capsules 1,300 milligrams POQ8 or PRN, not to exceed 3.9 grams per day. Maximum dose. Acetaminophen-containing products. Not to exceed a cumulative dose of 3 to 5 grams day of acetaminophen. Under supervision of healthcare professional, daily doses of up to 4 grams per day may be used. Tylenol extra strengthy. 500 milligrams, tab or cap, not to exceed 3 grams per day 6 tabs or caps. Under supervision of healthcare professional, daily doses of up to 4 grams per day may be used. Dosing considerations. When calculating the maximum daily dose, consider all sources of acetaminophen, including OTC, and routes of administration not to exceed the maximum recommended daily dosing. Renal impairment. GFR is greater than or equal to 50 milliliters, min, no dosage adjustment necessary. GFR 10 to 50 milliliters, min, administer Q6 hour. GFR 10 milliliters, min, administer Q8 hour. Continuous renal replacement therapy, administer Q6 hour. Hepatic impairment. Use extreme caution, avoid use as much as possible. Limit therapy to short-term use at doses not to exceed 2 grams per day. Dosage and indications in pediatric. Pain and fever relief. Weight-based dosing. Oral solution. Neonates 28 to 31 weeks gestation. 10 to 15 milligrams per kilogram. Dose POQ12 or PRN. May administer an initial load of 20 milligrams per kilogram PO. Not to exceed 40 milligrams per kilogram day or 48 are consecutive of maximum dose. Neonates 32 to 37 weeks gestation, 10 to 15 milligrams per kilogram, dose POQ8 or PRN. May administer an initial load of 20 milligrams per kilogram PO. Not to exceed 60 milligrams per kilogram day or 48 hours consecutive of maximum dose. Neonates 0 to 9 days, 10 to 15 milligrams per kilogram, dose POQ 6 to 8 hours PRN. May administer an initial load of 20 milligrams per kilogram PO, not to exceed 60 milligrams kilogram per day, or 48 hours consecutive of maximum dose. Neonates 10 to 29 days, 10 to 15 milligrams per kilogram, dose POQ for 8 hours PRN. May administer an initial load of 20 milligrams per kilogram PO, not to exceed 90 milligrams per kilogram day, or 48 hours consecutive of maximum dose. Infants 10 to 15 milligrams per kilogram, dose POQ for dasoxiprin. Not to exceed 15 milligrams per kilogram, dose or 75 milligrams per kilogram, day. Children and adolescents, 60 kilograms, 10-15 milligrams per kilogram, dose POQ for 6 or PRN. Not to exceed 15 milligrams per kilogram, dose or 1,000 milligrams, dose, whichever is less, or 75 milligrams per kilogram, day, or 4,000 milligrams, day, whichever is less. Fixed dosing. 6 years, ask a healthcare provider. 6 to 12 years, 325 to 650 milligrams POQ for 6 hours. Not to exceed 1.6 to 5 grams per day for not more than 5 days unless directed by healthcare provider. 12 years. Regular strength, 325 to 650 milligrams Q for 6 hours. Not to exceed 3.5 grams day. Under supervision of healthcare professional, doses of up to 4 grams per day may be used. Extended release, 1.3 GQ8 or not to exceed 3.9 gram, 24 hours. Dosing considerations. When calculating the maximum daily dose, consider all sources of acetaminophen, including OTC, and routes of administration not to exceed the maximum recommended daily dosing.